Hi everyone, you are listening to Shoaib Khan from Department of Chemistry, Hislop College, Nagpur, and today we are going to discuss about recent development in drug discovery for COVID-19 in reference to chloroquine and hydroxychloroquine drug. We know that coronavirus has now become a pandemic to the whole world. More than 7.6 million cases have been reported with this infectious disease, resulting in more than 4 lakhs deaths across the world and still counting. Common symptoms include fever, cough, fatigue, shortness of breath, and loss of smell and taste, whereas many of COVID 19 patients are asymptomatic and making it more challenging and difficult to control. According to World Health Organization, there are no available vaccine nor specific antiviral treatment for COVID 19. World Health Organization and NIH do not oppose the use of non-steroidal anti-inflammatory drug such as ibuprofen for COVID-19 symptoms. These are the structures of hydroxychloroquine and chloroquine which are used as a drug in treatment of coronavirus. Why chloroquine and hydroxychloroquine against COVID-19? What are the mode of action? It is recognized that SARS-CoV-2 having 76% amino acid homology like other SARS-CoV, hence assuming that it follows the similar kind of mechanism like SARS-CoV virus to enter into the host cell. SARS-CoV-2 has a spike protein which involves the two subunits S1 and S2. First S1 subunit is showing binding ability towards receptor ACE2 in adipose tissue, whereas second S2 subunit is involving in membrane fusion and insertion of RNA into the cell. Hydroxychloroquine is a weak base, causes the alkalization of endosome and lysosome, inhibits the endocytosis, and also stops the fusion of endosome with lysosome. Increase in endosomal and lysosomal pH decreases endosomal and lysosomal function, so inhibits the endocytosis. Second way of hydroxychloroquine is that hydroxychloroquine is also act as zinc ionophore. Zinc ions enter into cell through plasma membrane. Zinc prohibit RNA polymerase. Increase in the concentration of a zinc decreases the viral RNA formation. The third factor is presence of sialic acid on a cell membrane. Sialic acid helps to bind virus and enters into the cell. Hydroxychloroquine binds to sialic acid and prevents the binding of virus to sialic acid. In this way, hydroxychloroquine showing its antiviral activity. So what literature says about the use of hydroxychloroquine and chloroquine? Goddard et al. Have reported effective use of hydroxychloroquine with azithromycin in treatment of COVID-19 and says a good recovery in the patient. This study has several limitations such as a small sample size, limited follow-up, exclusion of patients during treatment and specific age group. However, another French group by Molina et al. Reported no clinical benefit and poor clinical outcome with this energetic treatment of azithromycin and hydroxychloroquine in coronavirus disease. They proposed that hydroxychloroquine acted as a protector for COVID-19 patient due to its antiviral and immunomodulatory effect. The maximum number of recovery or discharge was from control group and not from hydroxychloroquine treated group. Literature reveals that there are several disputes in the use of hydroxychloroquine for the treatment of COVID-19. Gottlieb et al. And Chen et al. Supports the use of hydroxychloroquine alone or in combination with antibiotics such as azithromycin. However, more scientists like Molina et al., Mehvis et al., and so many others did not support any significant effect or clinical outcome of hydroxychloroquine in treatment of COVID-19. Adverse effect. Several adverse effects associated with the use of hydroxychloroquine has been reported in the literature. Although hydroxychloroquine is less toxic than chloroquine, still it possesses some detrimental adverse effect which cannot be neglected. Some side effects like cardiac complications, QT prolongation to heart failure, neuromuscular side effects involves signal conduction disorders, nightmare, depression. Ocular side effects involve corneal deposition, blindness, blurred vision. Gastrointestinal side effects involve diarrhea, vomiting, abdominal cramping, nausea, abnormal liver function. Some allergic side effects also observed. Some other general effects like appetite loss, loss of weight also seen in the patients who are using hydroxychloroquine. So in conclusion, we can say that hydroxychloroquine shows antiviral effect against different viruses. Further, its use shows immunomodulatory effect. Extreme care is required for the hydroxychloroquine treatment in pregnant women, pediatric patient and patient with comorbidity in coronavirus disease. The individual use of both these hydroxychloroquine and azithromycin drug are associated with QT prolongation. Misuse of hydroxychloroquine without the physician's advice should be avoided due to lack of strong evidences which may result into one or more detrimental side effects. World Health Organization and several other countries like France, Italy, Germany has temporarily paused the clinical trials of hydroxychloroquine on 26 May 2020 owing to safety concerns. I would like to thank head of chemistry department and the principal of Islab College Nagpur. Thank you for listening.